In the annals of medicine, few creatures are as misunderstood and yet as enduring as the humble leech. For thousands of years, this blood-sucking worm has been a surprising and sometimes controversial ally to healers. From ancient rituals to modern operating rooms, the story of the leech is a fascinating journey through the evolution of medical science itself. So how did this simple annelid become a staple of the doctor's toolkit? And why is it making a comeback today? This is the history of the leech in medicine. Our story begins in the ancient world, where the concept of health was deeply intertwined with balance. On ancient Egyptian papyrus scrolls, we find some of the earliest references to bloodletting, a practice for which leeches would become indispensable. Physicians of the Nile believed that draining bad blood could cure a wide range of ailments, from fevers to infections. This philosophy was later formalized by the ancient Greeks, most notably Hippocrates and Galen. They developed the theory of the four humors: blood, phlegm, yellow bile, and black bile. Illness was seen as an imbalance of these vital fluids, and restoring equilibrium was the primary goal. Applying a leech was a controlled, effective way to remove excess blood, the most dominant humor, and bring the body back into harmony. Moving forward into the Middle Ages and Renaissance, the practice of leeching became even more widespread, though its practitioners changed. The role of the physician often separated from surgical procedures, giving rise to the barber surgeon. In workshops that were far from the sterile environments we know today, these tradesmen would perform a variety of procedures, including tooth extractions, minor surgeries, and of course, bloodletting. A patient suffering from a throbbing headache or a persistent fever would likely find themselves in a barber's chair, with leeches being carefully applied to their temples or limbs. The practice was so common that the red and white striped pole, now a symbol of barbershops, originally represented the bloody bandages of the trade. The leech was a readily available living tool in a pre-industrial world. The true heyday of the leech, however, arrived in the 19th century. This period saw what was known as leech mania sweep across Europe and America. Doctors, now in more established clinics, prescribed leeches for an astonishing array of conditions, from gout and pneumonia to anxiety and hysteria. The demand became so immense that it led to a full-blown industry. Jars filled with countless leeches lined the shelves of apothecaries, and wild leech populations were harvested to near extinction in some areas. To meet the insatiable demand, commercial leech farms were established, where the annelids were bred in controlled ponds. It was a time when the leech was not just a medical treatment, but a booming and often overused commodity. Just as quickly as it rose, the leech's popularity declined with the advent of germ theory and modern pharmacology. For much of the 20th century, it was relegated to a historical curiosity. But in a remarkable twist, the leech has found a new, highly specialized role in modern medicine. In the bright, sterile environment of a contemporary operating room, a surgeon might use a leech not for balancing humors, but for its unique biological properties. Following delicate microsurgeries, such as reattaching a finger or an ear, venous congestion can threaten the success of the procedure. A leech, when placed on the site, draws out the pooled blood while its saliva works wonders. This saliva contains a powerful anticoagulant called hirudin, which prevents clotting and promotes blood flow in the tiny, fragile vessels, giving the reattached part a much better chance of survival. From the papyrus scrolls of ancient Egypt to the high-tech operating theaters of today, the leech has traced a remarkable path through medical history. What was once a tool of humoral theory has been reborn as a precision instrument in microsurgery. This journey from a symbol of archaic medicine to a modern medical marvel shows that sometimes nature provides the most sophisticated solutions. The story of the leech is a powerful reminder that in the quest for healing, old wisdom can often find new purpose.